Hello, and thank you for joining us for another series on community connections, uplifting the public and nonprofit sector. I am Katrina Pratt Roebuck, and I am the founder and CEO of Uplifme. Today, I have the absolute pleasure of interviewing Jenne Johns, the president of Once Upon a Preemie. Hello, Jenne, and thank you so much for being here.
Hi, Katrina. Thank you so much for having me.
So, Janae, I've known you for a long time. We started, I think, we met when our children were in daycare at the YMCA, right? Isn't that how long ago we've known each
Maybe,
other?
maybe even a little longer.
Yeah, and so, I've known you for a long time and admired the work that you've done. You sort of, you came into this work based on lived experience and you turned it into an opportunity to help other families. So, want to really talk to you about what your organization does and who you serve.
Well, Katrina, again, I'm so honored to join you on your platform, and thank you for all the work that Uplift Me does to educate and inspire and connect social service providers and our community together. Once Upon a Preemie is a nonprofit organization on a mission to transform the delivery of healthcare so that it is high quality, equitable, and family centered. Our vision is to drive equitable health outcomes for 1 million Black preemie families. And as you mentioned, this work is deeply personal for me, based on my lived experience as a preemie mom, but also as a former healthcare executive leading and driving health equity, quality improvement, and community empowerment. So Once Upon a Preemie is really a unique opportunity for me to live under one umbrella and
Mhm,
share who I am with the world to help close gaps that we know exist. At Once Upon a Premium, we offer three services. First is healthcare workforce development training, i.e., implicit bias training for all
mhm,
healthcare professionals who touch the lives of Black birthing women, and in particular, those families who land in the neonatal intensive care unit. The
mhm,
second
mhm,
service that we offer is policy advocacy. We really want to make sure that the needs of preemie and NICU families are not lost or missing in any maternal and infant health legislation. And lastly, we
okay.
offer family empowerment services, and that takes shape in many forms. We bring our care packages and education and book resources to existing community events. We
Mhm,
donate care packages and books to NICUs across the country. And more recently, we've stood up our NICU Nest Read to My Preemie program, which is a
mhm,
unique opportunity for Philadelphia-based preemie and NICU families to receive virtual support when they are
mhm.
bedside with their babies in the hospital and in-person support once they have been discharged and are now home and in the community navigating life after the NICU.
Yeah. So, can you talk a little bit about what the definition of a preemie is and why this work is important? What are some of the experiences that you believe are different for families who have preemies versus families that have children that have gone full term?
So that's a great question, Katrina. A preemie baby is a baby who was born preterm, so before 37 weeks of gestation.
Okay.
A micro preemie is a baby who's born weighing less than 2 pounds at birth. And so,
Mhm.
depending on the level of prematurity and the severity of the birth, some of our preemie and micro preemie babies have to live in the hospital up to and past 1 years of age. And so,
Wow. I
the
didn't know that.
same, yeah, the same. Experiences that moms and dads have in the hospital during the birthing journey is continued until the baby is healthy and
Mhm.
strong enough to go home. And as we
Mhm.
know, in the Black community, we are facing a Black maternal health crisis where care is
Mhm.
inequitable. And I put
Mhm.
a period there. That journey doesn't stop for a preemie NICU family. It continues
Mhm.
on. And so we want to make sure that, at least for the families, they feel supported in navigating that very abnormal introduction to parenthood. Even for families who have other children, even for families who may have been in the NICU prior, one NICU journey experience is one NICU journey and experience. And we want to help them
Mhm.
normalize that journey if they can by encouraging them to do things like reading to your baby. You can do that
Mhm.
whether your baby is home in the bed or whether they're in the
Mhm.
hospital in an isolate. Asking
Mhm.
the right questions, advocating for your baby, that never stops, whether your baby is
Mhm.
full term or preemie. There's an extra and added layer of advocacy that's needed for preemie babies, though, because unfortunately, families are not placed at the center of the NICU care delivery model. Families are
Mm,
outsiders coming into this very unique intensive care unit in the hospital, if you will. And it's
mm.
very important that mom's intuition, dad's intuition, your questions or the questions that families have get addressed because in some instances it is life-saving or life-preserving.
Wow. That's interesting. And I would have not never known that that dynamic existed. And so just want to go back a little bit into how you started. Can you talk about, why did of the millions of people, I'm sure that have the same and similar experiences that you've had having a preemie, what led and inspired you to do this work? I know that you have a son that's a preemie, but what was it that actually made you say, you know what? I'm starting this organization to help other families who've had the same experience.
It was a combination of experiences um, leading up to returning back to work in the middle of my
Okay.
son's NICU journey. So
Okay.
unfortunately, families have a preterm infant. There is no extra maternity or paternal leave. You get the same bucket or
Interesting.
pot, regardless if your baby is home with you or not. And so I
Mm,
needed to break my maternity leave up so that I would have some time left for when he was discharged to come home. Pain
hmm
point number one that I was like, huh, an area that we need to start addressing in this country because
hmm
this this doesn't feel normal and this is something that we can fix.
hmm
Second pain point that I experienced in the NICU that raised my eyebrows was when we were encouraged to read to our son. I was there from sunup to sundown, usually the first mom in the NICU, the last to leave. And one of the nurses encouraged me to just start reading to my son. She said it'll help normalize the experience, help stimulate healthy brain growth and development. So before you know it, my son had a library stacked up taller than his isolette with book donations from family and friends. And I loved reading books to him. However,
hmm
none of the books that we've read spoke uniquely to our situation as preterm
hmm
parents having to parent and nurture in the NICU versus home. And so that was the first thing I did coming out of the NICU was to write the book Once Upon a Preemie. At the time,
hmm
it was the nation's first and only lullaby written for preemie and NICU families. And honestly, writing and self-publishing that book helped open the door for me to share my journey, not only as a preemie mom, but as a Black preemie mom and some of the disparities that I started to observe and some that I had
hmm
personally experienced. And so 5 years before Once Upon a Preemie nonprofit organization existed, the the pillars of the work of Once Upon a Preemie were already being done. So I
hmm
was a new
hmm
mom, home with this medically fragile micro preemie baby. I was still working in the health insurance space, leading disparities of quality improvement. And then
hmm
this other opportunity as this preemie mom advocate who was starting to do
hmm
the education of the healthcare professionals, the policy
hmm
advocacy, and then, oh, by the way, I don't like selling my book to preemie parents anymore. How can we donate it? So the
Yeah.
work was
Yeah.
already being done before. And so when it came time to put the structure, right, the nonprofit
hmm
structure around Once Upon a Preemie, it became a very easy no-brainer. The work was already being done, the gears were already in motion. We just needed a tax structure, if you will.
Right, right. That's a fascinating experience that you've gone through that was something you can turn into these deeper insights and then this meaningful work. I think that I have the privilege of speaking to people like you and others who have similar stories, and having that lived experience really allows for you to go into a depth that folks that haven't had the experience wouldn't know. Some things you just know from experience. And so I'm really touched that you were able to pull all those pieces together and really be there as an advocate for probably a lot of people that would not know how to advocate for themselves. How do people access the different pillars of work that you do?
Sure. Well, we are always open to making our work available to hospitals, providers, states, local municipalities, legislators, etc. Um, Accessing our services is as simple as visiting our website, onceuponapreemie.org. On our website, there is a contact us form where anyone can leave us their contact information in the nature of wanting to connect with us, and we'll follow up.
Okay.
Um, also, yeah, we're also on social media platforms, of course. We have a LinkedIn page, Once Upon a Preemie Academy, and our Instagram is at Once a Preemie.
Okay. And also I wanted to, following up with that, ask about the advocacy work. If folks are interested in joining or supporting your advocacy work, how can they do that?
Same pathway and process. We have the contact us form on our webpage. And of course, we show up and support for those of your listeners who are in the state of Pennsylvania, we are one of the Pennsylvania Mom the Bus advocates and stakeholders. And
Okay.
so, where and when there's opportunity for us to be engaged, please join us. And that information for the Mom the Bus can be found on PA, I believe it's PA Black Maternal Health Caucus or PA Caucus.
Okay. Okay. We'll
You
put
can
the,
edit that. Yeah, you can put the correct information in there.
okay. Okay, so we'll put the information in the show notes so that folks can access that. And so in addition to that, if what types of things that you have coming up that you are excited about and that people can engage with Once Upon a Premium?
We are most excited about our upcoming NICU Nest Read to My Preemie program celebration and open house. That is taking place Saturday, August 15th from 12 to 4 p.m. We are looking to engage the families who have been participating in our NICU Nest Read to My Preemie program and new families who may be interested in learning more, participating in our very fun-filled interactive day and receiving information on developmental milestones, how to read to your baby, how to feed and read your baby, and connecting with healthcare professionals in our community who offer social services as also developmental services for preemie NICU families. That event is still open for registration, and so we encourage any preemie NICU family member in the city of Philadelphia with a preemie up through age 5 to join us.
Okay.
We will provide a link for registration, but for now, folks can visit onceuponapreemie.org/NICU Nest for more information and to express interest in joining.
Okay,
The,
that's great.
the next exciting event that we have taking place is our annual Party for Preemies, which will take place
Okay.
on Monday, November 16th at the African American Museum. And the next day, we are hosting our full day fifth annual Black Maternal Health and Neonatal Equity Conference at the Lowe's Hotel in Philadelphia. That is a full day of powerful networking, education, learning practice-based solutions from Black woman-led, Black woman-serving organizations to help us close the gaps in neonatal disparities. We hope that your audience members will join us because our conferences do not disappoint.
Yeah, and I did not realize this was your fifth year.
Yes.
Congratulations on that. That's
Yeah.
amazing. That's
Yes.
amazing.
Thank you.
Yeah. So, okay. So those things are helpful. And the event coming up this weekend, we certainly will support getting the word out about that. Um, in the meantime, and just in an ongoing way, how can people support Once Upon a Preemie? Do you guys accept volunteers? And certainly, do you accept donations? How can people support you?
We love support of all kinds. We don't turn support down. We are a
Mhm.
nonprofit organization, and this year has been exceptionally different than years past.
Yeah.
Fundraising, soliciting sponsorships and donations.
Right.
We're always open to receiving donations for the infant care supplies that we provide to families,
Mhm.
diapers, wipes, books, just essential baby items that may be difficult for some of our families to access.
Mhm.
We are also always open to financial donations to help with the operations of the organization. It takes resources to keep these programs alive, running, and accessible to families so that we can continue to offer everything that we do at Once Upon a Preemie free of charge.
Oh, that's great. Thank you for adding that. I did not ask you and asking how people access the services if there was a charge. So thank you for sharing that. And I'm assuming that anyone can access the services regardless of income level. Is that correct?
We want to remove all barriers to people being people being able to access our programs and services. And so, regardless if you're insured, whatever your income level, whatever pocket of the city of Philadelphia that you live in, we want to support you in making sure you receive the resources, the education, and the care that was not offered at the time that you needed it. So,
Yeah. Yeah. So, I thank you for going in depth and sharing what you do. I can only imagine. As a parent myself, if you're a parent, that taking home the baby, can be a, intimidating journey, especially as a first time parent. But as a parent of a preemie, I'm sure there's some added level of that sort of intimidation. And so I'm sure that what you're doing is so invaluable that words can't express how families probably appreciate the support that they get from Once Upon a Preemie. So thank you so much, Jenne. Thank you for spending time talking about your wonderful organization.
thank you for having me, Katrina. It's been a pleasure.
Thank you. Take care.
You too.